We're going to talk about an expander. Expanders are really important for several reasons. So if you've been told you need an expander, it can be because the upper jaw is too small and too narrow. This can have implications for breathing. So when you're young and growing, if we can widen that upper jaw out, it actually widens the base of the nose. It can help with airway. It can help if you've been to the ENT and you have large adenoids, large tonsils, things that are making breathing harder. Changing the shape of the upper jaw can also help as well. So we a lot of times work with a team, with pediatricians, with ENTs, with sleep doctors, also for speech. So some people are not able to pronounce S's, R's. There's different things that widening the upper palate will help. And then we can retrain the tongue to be able to pronounce the words appropriately. So sometimes even a speech therapist at school or one that you've seen on your own would recommend maybe it's time to see an orthodontist and we can work together hand in hand to help with speech issues. When you have an expander in, there's a growth plate that runs down the center of your jaw in the top. You have to still have growth left to do to be able to do a rapid palatal expander, which is what we call this, which has the little key. Growth hormone is usually released like 8 p.m. to 1 a.m. So it's great to do it kind of right before you get into bed. It'll feel like a big stretch. So I always tell people it's not really sharp like a bee sting. People are nervous about doing it. You feel that pull, and that is where the growth plate is going from passive. It's not completely locked together like an adult, but a passive growth plate because it stops widening on its own around the age of 8 to 9 years old. We can help it though before it closes down completely to widen. So when you turn it, slowly opens every day, just a little bit more. And then what happens is new bone grows in here. So expanders usually need to stay in the mouth anywhere from 6 months to a year after the completion of turning. Also, the amount of time you have to turn is very dependent on the person. So some people only have to turn for 2 weeks. Some people will have to turn for more like 4 weeks based on how many millimeters, how much expansion we need for our goals. The other reason sometimes we'll do expansion, even if the jaw isn't really small, is if there's a lot of crowding. So these can be used in certain cases to help teeth come in if they're stuck in the gums. Also be used to make space for teeth that come in high up so we can bring them down without having to extract teeth. Another reason why we might use an expander is for what's called a crossbite. So if the bottom jaw is off to the side because the top jaw is too skinny, the teeth are supposed to sit with the top teeth on the outside of the bottom. If those teeth are on the inside of the bottom teeth, we know that top jaw is too small. So we need to bring these teeth up and out to get them in the normal placement. The reason we care about this is because as you get older, if your teeth are hitting incorrectly, you're more likely to chip and break teeth and end up needing dental work, crowns, that type of thing. So we want to address this in the youth and the young population of people that we can actually address their crossbite and not have to do surgery in the future. And if you're fully done growing, you would need a surgery to correct a crossbite. The other reason is the jaw can grow off to the side. So most kids that have a crossbite, whether it's on one side or both, and you could have either, and their jaw will shift one way or the other or even forward. We don't want to see a shift in the jaw because the body actually will grow in that direction. And then the jaw will be off to one side and cause an asymmetry. If that is not corrected when you're young and still growing, then you would have to have a jaw surgery to line that jaw back up. So we want to try to prevent that by expanding that upper jaw, making it bigger to fit with the bottom. So if you think about it, the bottom jaw is almost like a shoebox and the top is like the lid. So we need the lid to be bigger than the shoebox for them to function well together. If your lid is too small, you're not going to be able to get it to fit and you're not going to be able to close that shoebox well and things are not going to function well. Same thing with teeth and with jaws. So there's really a lot of different reasons why we would use an expander. When you expand, usually we'll show you how to do it in the office. It's a lot easier when you're here because then your child is laying back, the mouth is open wide. So I always tell people if you're going to do it at home, you almost want your child to lay on a bed, to lay on a couch with their head back, tipped far back as far as it will go, and have them open as wide as they can. And then somebody could maybe hold a phone light or a flashlight to be able to see and to be able to turn that expander. Once you get this, it's super easy. I've done it on my daughter. She had an expander and we were able to do it just right in the bathroom, right before we brushed her teeth every night. She would tip her head back, I would turn her expander, and it became super easy. But the first couple times you do it, it's definitely a little bit awkward. You also want to make sure you get a complete turn. What can happen is sometimes when you put the expander key in, you can see it has this little bend in it. You want to make sure it goes all the way up to the bottom of the bend here and really sinks in to this hole. Once you've got it in there, what you want to do is take the handle, so we're going to slide it in, and then we're going to take the handle and push it backward until the next hole pops up. So you can see this next hole just popped up here. If you only turn it halfway, which can happen sometimes, you think you got a full turn. So if you turn it, you only get it halfway turned. The next time you go in, you may put it back in that same hole and turn again, and you really haven't completed 2 full turns. You've only completed 1 turn. If that's the case, when you come back to see us and we haven't gotten enough full turns, we may say, oh, we need to do a little bit more. We're going to do 2 more weeks and then we'll check again. A good way to know that you're getting a full turn is your child should be able to feel it. We talked about that stretch. They should be able to say, yeah, mom, that felt the same as it did when we did it in the office. Another way is that you should be able to see there's these little threads of the expander as you turn it that start to become visible. And these 2 larger metal pieces get farther and farther away from the hole. So as you're turning, you should see those threads growing every day, and you don't want that expander, those 2 metal pieces, to still be right next to the hole. The other telltale sign is you should start noticing a gap between the front teeth. That is a beautiful sign the expander is working well. However, if your child has an overlap of front teeth, you may not get that big gap like we would see in some other kids that either start with a little gap or have teeth that are a little straighter when we start. If you have the overlap, they may start almost looking like they're straightening on their own. Sometimes the patients come in and they say, I feel like I have a SpongeBob gap. So that is totally normal. We love that. It means it works. And then after we finish turning, so whether it's 3 or 4 weeks, we'll have them come back in, put braces on the teeth, and then we'll be able to close that space up and make room for the teeth on either side to be able to come down into the arch. So that's the whole goal of this. Also, some kids have what's called a crossbite. So if the jaw is off to one side and the teeth are supposed to fit together like this, if they are opposite and that upper jaw is too skinny, the jaw can actually grow asymmetrically one way, and you can end up with a jaw that is totally off to one side because that jaw has shifted that way the person's entire life. At that point, a lot of times the only thing that you can do is jaw surgery to be able to realign that jaw with the center line. This is why it's so important that kids that have that crossbite, we see them when they're young and growing, and we're able to correct the crossbite and get them out of that shifting bite. We don't want them to shift forward and we don't want them to shift to the side. We want their bite to fit together just straight up and down. And so the expander will help us with that. So this is an example of a child that came in when she was 8 years old and had a very, very narrow palate. You can see here that there's just no room for these teeth to fit in there. She had some breathing issues. She had some self-esteem issues with the way that the teeth were turned and coming in, and definitely a shift of her jaw, which we wanted to correct while she was young and still growing. This is the after the expander comes out. At this point, all the permanent teeth have been able to come in. The canine teeth, you can see there's plenty of space for those to erupt. And the front teeth are a lot straighter, giving her more confidence as she goes through those elementary and middle school years. This is when she was in 5th grade. Also, breathing was so much easier for her. So we were able to achieve all of our goals using the expander in this early phase 1 treatment that took about a year with some braces on those top teeth and an upper expander to widen that jaw and make space.